And among youth, anxiety, depression, and self-harm have skyrocketed, especially since the pandemic. These numbers aren't just statistics, they represent people, real lives, real families. And this isn't just about those in psychiatric hospitals. It's about the exhausted mom with untreated postpartum depression, the teenager who smiles on TikTok and cries herself to sleep, the veteran who hasn't slept through the night in 7 years, the physician with panic attacks in the break room. Mental illness is everywhere, yet help is often nowhere. What's fueling the crisis? Mental illness is not new, but this crisis, it's been growing for decades. Here are some of the key factors making it worse. 1. Lack of access to care. 160 million Americans live in areas with a shortage of mental health providers. Wait times for psychiatry appointments can be 3 to 6 months or longer. Insurance companies often reimburse poorly for psychiatric services. Result? People go untreated until they end up in ERs, jails, or morgues. 2. Stigma and silence. Mental illness is still taboo, especially in certain cultures and communities. People fear being judged, labeled, or discriminated against. Many suffer in silence until it's too late. 3. Social media and technology constant comparison, online bullying, digital addiction. Kids are growing up with likes, filters, and FOMO, but no emotional tools. The rise in depression and anxiety among Gen Z is no coincidence. 4. Poverty and inequality. Mental illness is both a cause and a consequence of poverty. Marginalized communities face systemic barriers, lack of culturally competent care, and trauma passed down through generations. 5. Trauma and isolation. COVID-19 didn't create the crisis, but it made it worse. Isolation, grief, job loss, domestic violence. A nation already hurting was pushed to its limit. Who is being left behind? No one is immune to mental illness, but some groups are especially vulnerable and underserved. Children and teen school counselors are overwhelmed. Youth suicide rates are rising sharply. ADHD, autism, trauma, and anxiety often go untreated or misdiagnosed. Working adults. Burnout is real, especially in healthcare, education, and frontline jobs. High-functioning depression is common, people who seem fine but are drowning inside. Veterans' PTSD, depression, and substance use disorder are rampant. Many return from war zones only to fight another battle at home, alone. Minority communities, Black, Indigenous, and people of color, BIPOC, face higher rates of trauma and lower access to care. Language barriers, racism, and cultural stigma often prevent treatment. The incarcerated, our jails, are now our largest psychiatric institutions. Over 50% of inmates have mental health issues, most untreated. We've criminalized mental illness instead of treating it. The system is broken. Here's how. Let's talk about the mental health care system itself. It's fragmented, underfunded, confusing, and painfully slow. Inpatient psychiatric beds have been slashed nationwide. Primary care physicians are forced to handle complex psychiatric cases without the tools. Therapists are overwhelmed. Many are out of network or fully booked. Rural areas have almost no access to psychiatrists or licensed counselors. Even with insurance, it's hard to find care. Without insurance, it's almost impossible. And when someone finally does get help, they often receive 10 minutes of medication management instead of the therapy, support, and follow-up they truly need. This is not healthcare, it's mental health triage. My view as a psychiatrist. As a psychiatrist, I've watched brilliant minds spiral into psychosis, gentle souls trapped in trauma, young adults robbed of joy by untreated depression. But I've also seen recovery, transformation, healing. Psychiatry isn't just about medications, it's about understanding the whole person, their story, their struggles, their strengths. It's listening without judgment. It's helping someone rediscover the will to live. And it's heartbreaking to know that while I'm helping one person, 100 more are waiting, suffering, or being dismissed. The power of early intervention. Here's what we know for sure. Early intervention saves lives. Kids with early support grow into resilient adults. Teens in therapy are less likely to self-harm. Adults who seek help early avoid years of silent suffering. But that can only happen if schools have trained counselors. Primary care includes routine mental health screening. Parents know the warning signs. Communities stop shaming and start supporting. We need a new mental health model. If we want to fix this crisis, we need to rebuild the system, not just patch it. Here's what that looks like. Universal mental health coverage, just like physical health, more training for primary care providers in psychiatry, better pay and support for therapists, social workers, and nurses, telepsychiatry in every rural community, trauma-informed care in schools, prisons, and shelters, mental health education as part of standard curriculum research funding for prevention and brain science community-based programs that reflect diverse cultures and values, how you can help. Even if you're not a doctor, you don't have to be a psychiatrist to make a difference. Here's how you can help right now. Listen to those around you. Really listen. Ask people how they're doing and mean it. Share your own mental health story. Vulnerability is contagious. Advocate for better services in your community. Support mental health nonprofits or crisis lines. Vote for leaders who prioritize mental health policy. Most of all, talk about it. The more we normalize mental health, the more people will seek help. Last but not the least, a message of hope. This crisis is real, but so is the hope. Mental illness is not a weakness. It's not a moral failure. It's not something to be ashamed of. It's part of being human. We don't need to fix broken people. We need to fix broken systems. And we need to replace shame with compassion, isolation with connection, and silence with truth. As a psychiatrist, I can offer therapy and medications. But what heals most is community, understanding, and hope. Let's be part of the change. Let's build a world where mental health is not a crisis, but a priority. Thank you for listening.